Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello there, Nita Valens. I'm living it up. What about you?
I'm great, and happy day to you. And
yeah, happy birthday to you.
Oh, thank you. Happy belated birthday to you.
We're both, 21 now?
Yes, 21. And I had somebody tell me that I looked 21 the other day. I thought, oh, poor guy, he needs glasses.
Nita, do you know what happens when a frog's car breaks down?
Ribbit.
Close.
Ribbit.
It gets towed.
That's a good one.
I know it is.
That's hilarious.
How about this one? Why couldn't the lifeguard save the hippie? He was too far out, man.
That's hilarious. I love that one.
I was just reading my list of jokes that my patients send me. They are hysterical. I was going crazy here.
That's fun.
Yeah, I've got some more here just in case, Nita. You better get some callers.
Okay, well, let me give the phone. Let's give the phone number.
Let me do that.
You do the phone number.
And if you guys don't call in, I'm going to have to tickle Nita with some jokes and stump the star here. Anyway, the phone number to talk to us right now, give us a call. Get on your phone. Write this down. It's 866-870-5752. I'll repeat it for you, 866-870-5752. And the super good news is if you call us during the show, you have the next hour to go. I'm going to send you for free $25 book that I wrote called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What it's all about is why you should think about using regenerative medicine, your stem cells, your platelets, which is a real simple procedure to heal your body instead of having an orthopedic surgery or a neurosurgery. Now, this procedure that I do, or these procedures that I do, I've been doing for about 25 years, and they've been very good to me because, hold your hats, I do them to myself. I inject myself. And over the 25 years, I've been injured many times. I am a sports junkie, and I do repetitive things over and over and over. I can even hurt myself playing golf. I know that sounds crazy. People think golf is not really a sport, but we get tons of golfers, and they get every kind of injury you can imagine. I get every kind of athlete, football players, golfers, high-speed water skiers, snow skiers, tennis players, weightlifters, MMA guys. Every kind of athlete in the world comes to me. I have very elite athletes, and I have weekend warriors, guys that just go out once in a while, women that go out once in a while. So the interesting thing about the work I do is as we age, even if you're not an athlete, the body, like any machine, tends to wear down. And these same procedures work on all kinds of people, whether you're an athlete or not. And one thing that I see very often is people come in that are overweight and they blow out their knees. The cartilage in their knees is worn down because of the excess weight. I mention on every show, every extra pound on your abdomen is about 4 or 5 extra pounds biomechanically on your knee joints. So it's something to consider. We teach people the keto diet, and you can just look up KETO and diet and learn how to do it yourself. It's very simple. You just cut out carbohydrates. Not a big deal. So what else do I want to tell people? Let's see. I do the musculoskeletal body, but we also do the face, and we do a procedure called the vampire facelift where we inject the face with your cells also, platelets and stem cells. and we can have this work on the top of the head by stimulating hair follicles to regrow and thicken up the hair. And if you want to catch me at the office, if you have more questions than we talk about on the show, the phone number to the office is 800-300-9300. So, Anita, do you have anything to add to all of that?
I do. I want to let people know about your fabulous website. It's www.lastemcells.com. That's lastemcells.com. And you can email Dr. Darrow off of every page on that site. And you can watch him performing the treatments on videos. That's really important for people that are new to this concept of regenerative medicine.
Yeah, it is. And it's something that even people that have read about it for years, I have people that have tracked it since its beginnings. And I've been doing these things. It used to be called proliferative therapy. And then somehow or other the word regenerative medicine came on board. So you don't hear the word prolotherapy very much anymore. But it's the same thing, really. It is proliferating brand new tissue to grow back and rejuvenate the body. But the name has changed. And back in the day when we talked about prolotherapy, we were injecting, believe it or not, concentrated things like sugar water to create irritation, which is one of the ways the body heals through inflammation. And that's another mind bender. It's like, why would you want to inflame the body when it's already inflamed? When you're in pain and there's inflammation, what we do with these injections is we kick up the inflammatory state just a little bit more to bring fibroblasts to the area and lay down new tissue. And back in the old days, I used to use things like sodium moreuate, concentrated dextrose, zinc sulfate, and other things like that. And I always experimented on my own body. I didn't really have any teachers back then. And I'd read about something that somebody had tried. I'd try it myself, or I'd try other things. Last night, I just tried something on my knee. I injured my knee running up my mountain, sprinting as hard as I could. Both my knees. One of them is already healed. The other one is still having an issue because I injected it with hyaluronic acid. And you've heard of different types of injections that doctors do for the knee that are hyaluronic acid, like Supartz and Euflexa, other things like that. Well, I tried it on mine, and I had an allergic reaction. So my thigh swelled up. My knee has been painful ever since, much more than before I injected it. And it's starting to heal, but I'm still limping around. It was an experiment for me. And I know now I will never inject anyone's knee with hyaluronic acid. I never did before because I never believed in it. It is a lubricant, and most people that come in with the bad knee already have hyaluronic acid, and they're called an effusion. That just means fluid in the knee. So I'm not sure why doctors do these. Sometimes patients tell me it worked for a while, and then it didn't work after that. So I don't do that. So if you're coming for a hyaluronic acid injection, don't come to me. I'll send you somewhere else. I don't do that stuff. And now I never will because my knee is sore. And I'm working on it with different things. I just injected the medial meniscus with some cells, and I'm hoping for a great outcome. And next week I will try something else. I'm gonna win. And I say that because I've had areas of my body when I've been experimenting that I didn't know what was going to happen. And it would take, typically it would just take me like 1 or 2 treatments to fix whatever area I had injured. And then I had one area that didn't heal up, and I had to go after it for quite some time. And I was thinking, my goodness, I already had surgery on that area that failed, and now it seems that my own work is failing on it. Well, it didn't fail, it healed up, but it took a while. And that's the thing you have to understand about regenerative medicine. I can't project when you will heal. I'm going to go to Robert now. Thank you for calling in, Robert. You're having problems in your L4 and L3. That's your low back, and you live in San Pedro. Thank you for calling in. So, Robert, let me ask you some questions. How old are you?
58.
Okay. And when did your back start hurting you?
I was hit last September on a hit-and-run accident, me and the family, and went to the doctors, did all the hospital visits, and now I'm trying to recover and heal up, and there's like no hope. They're saying injections are my only option. Is what one surgeon was telling me. And
injections are your only option?
In my spine.
Okay.
For pain.
Okay.
And also,
so you're having pain in your spine. Do you have any pain down your legs?
Yes, it does radiate if I'm exerting myself in any way.
How about right this minute? Do you have pain in your legs right this minute?
Just slightly. It goes to the hip and the lower buttock area.
Okay. So here's something of importance for you. The injections that they're talking about giving you can be multifactorial. It could be what's called an epidural, which is a big burst of a steroid shot. Does that name ring a bell? Epidural?
Yes, it is an epidural that's suggested.
Okay, so I don't suggest that, but I'm not your doctor. And I always tell people, listen to your doctor until I'm your doctor. So you're not my I'm not your doctor until you walk in the office and we do an examination in history. So I want everybody to know that. So what I'm talking about on the radio is educational in nature. Okay, so I'm giving you information. When I have that information from someone, I tell them don't get an epidural. Okay? And the reason why is an epidural is a big dose of a steroid that's not really great for the body. There are cases when it's needed, but when you just have radiation into what you're calling your hip or your buttocks, I don't think an epidural is the way to do it. Now, if I inject a big dose of a steroid in your arm, your back is going to feel better, okay? The reason is because that steroid goes systemic. It goes all over. And there are people that end up getting an epidural with adrenal failure and all kinds of other problems. So I don't really like doing that to people, and I don't do it to people. I'm going to bet you anything that if you were to come in the office, I would be able to examine you in 1 minute and tell you whether regenerative medicine can help you, which to me is the best way to heal if you can do it, if it's going to work, because it's natural. All we're doing is taking cells from your body and injecting them back in. So there's really, theoretically, there's potential side effects anytime you get injected, but I don't really get side effects from this other than, if you want to call this a side effect, you get a little bit stiff. So I injected my medial meniscus last night at the office after all the patients were gone. I did it myself, and my knee is a little bit stiff today. Does it bother me? No, it doesn't bother me. It's like after you work out, you get a little bit stiff. So I have to examine you, Robert, and I tell this to everybody. I get emails every single day from all over the country. Can you help me? Here's my MRI. Look at my X-ray. I go, I don't use those to determine where your pain is coming from. I like to have the images to give me ancillary information, but they don't tell me where your pain is coming from. And in my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, there are studies in here, which I'm going to send you for free for calling in, by the way. There are studies in here that show that images don't tell you where pain is coming from. And unfortunately, too many surgeries are done without an examination. So the surgeon is going on an image, okay? He goes, look at that. We got to cut that out. Look, you have meniscal tear in your knee. Ooh, wow, you got a rotator cuff tear in your shoulder. We got to cut you. And that's what happened to me. I had a shoulder surgery in medical school. That was an abomination. I don't blame my surgeon. He was my friend. He was my professor. But it came out bad, and my arm was swollen for months. And I had high fever, and I had these giant blisters on my arm, and I thought I was infected. I wasn't, thank goodness. But it didn't heal, and it was worse than before the surgery. And then about 4 years later, I discovered regenerative medicine, which we used to call prolotherapy back in the day. And I injected my own shoulder, and I woke up the next morning completely pain-free. And that started my desire to learn more and more about this and to use it on my patients. in the early days, 25 years ago, when I was doing this with patients, I would mention that it had worked on me. I did my wrist, I did my shoulder. I did my low back also. I didn't inject my own back because I can't see back there. But I've since then done both my knees, both my shoulders, my right wrist, both my elbows. I've had other people do my neck and back. And so far, every time I have worked on myself or had other people work on me, I've healed up. So it's been, I'm a great testimonial for this work. I've probably had more of it done on me than anybody I know because it's easy. I can inject myself. And when I get injured, I just inject myself. So I think there's really good hope, Robert, that I can help you. I can't tell you until I do the examination. But from what you're telling me, what you have is what we're going to call a sprain. That means the ligaments in the low back have been sprained, stretched out from that car accident. And I had that also. I was rear-ended at 50 miles an hour. And if you saw the other car that hit me, you wouldn't think anybody lived through the accident. And I had 4 surgeries on my face to repair it. And my neck hurt like you know what. And I had one of my buddies inject my neck, and I'm a lot better. So there's good hope for you. Make sure everybody listening, if you decide to get a surgery, make sure your surgeon examines you first and finds the pain generator. That is the spot where the pain is coming from. Don't let them just decide to operate because you have a rotator cuff tear or you have some arthritis or something like that. Or in your case, Robert, you might have a herniated disc. You haven't mentioned that. But none of those things necessarily cause pain. So make sure you get an examination and that the surgeon is not doing an operation based on an image. They fail all the time. I get patients in the office almost every single day that have a failed surgery. That's a surgery that worked out wrong, came out bad. Okay, I'm not putting down surgeons. I love surgeons. They are very needed, and that's hard work. And unfortunately, I think they ought to stick to the times when the surgery is needed. And most of them that I see for musculoskeletal medicine should not have been done. I'm just saying it the way I see it. I could be wrong. I'm not saying I'm Superman of medicine. I'm just saying that from what I see in my office, almost every surgery that walks in the door has been a surgery that shouldn't have been done. Now, if you have a broken bone, you better get to the surgeon right away. But if you have a dead leg, with a herniated disc pressing on a nerve and you can't move, or you're paralyzed, you better get to the surgeon right away. But I don't see those kind of cases. Maybe in a trauma center or something like that, they see them all day long. When I worked at Rancho Los Amigos Hospital in my residency at UCLA, we'd have a lot of those cases because that center was for spinal cord injury and brain trauma. So we'd see a lot of surgeries that had been done that really needed to be done. But typically the ones that if you're walking around, you don't need a surgery. Every joint replacement I see, I'm very curious about. I wish I could have examined that first because I have people come in all the time who have, shoulder pain, hip pain, finger pain, toe pain, whatever. And they tell me their surgeon said they need to have a joint replacement. And I move them around and examine. I go, well, in my opinion, you don't need it. You can do what you want, but I think we can get you better. So, it's up to the individual. I don't tell people what to do. Patients always say, tell me what to do. And I go, I don't do that. I'll give you information. I'll educate you, but you got to decide.
Right. The other issue is I do have a meniscus tear from that accident. I did have surgery in 2014, but it was a totally different side of the same leg.
Okay.
Medial. But
okay.
They wanted to schedule surgery right away, and I didn't. I know there's other options. Just I didn't know how far stem cell was till I caught your show. So.
Sure. Well, I've got stuff on my body all over that's torn up. I know because I use an ultrasound and I look, and I don't have pain in those areas. So as an example, my right shoulder has a a supraspinatus tear and a subscapularis tear. Those are two of the rotator cuff tendons. And I have a macerated and torn labrum. I have no pain in my shoulder, and I still have those things there. I've injected my shoulder, did it fix those things? No, it doesn't need to fix those things because they're not generating pain. It may have helped fill in some of the openings and the tears. I don't know. I put stem cells and platelets in those tears, but they're still torn. But I have no pain. I have full range of motion. So you tell me what that's about.
Yeah.
I don't have all the answers. I just know that I see many cases with failed surgeries, and I see many cases, where we do regenerative medicine, injecting stem cells and platelets, where people get better, and that were ready to have surgery. I take care of people every single day that were ready to have surgery, that didn't need it, that got better with what I do. And I'm not saying what I do is the panacea.
I have family members that had spines fused and such, and then their quality of life they just deteriorated.
I see it all the time. And then they have pain stimulators surgically put in, and then morphine pumps. And I don't see many of those work. I'm sure they have to work in a lot of people, or they wouldn't keep doing them. And they're very expensive, and they can get infected and all kinds of things. So I like the conservative route in medicine, which, I found my niche, and I'm very grateful for it because I'm able to do it on myself and fix myself. I mean, if I didn't know about this, I would probably have had 20 surgeries already. And I do have people that come in that have had so many surgeries, I can't believe it. When they come in, they go, should I get another surgery on this area? I go, didn't you learn yet? And they go, but I don't know what else to do.
My first meniscus tear didn't solve the problem. You're promised 100%, then you're deemed like 75, 80%. So that's not 100% in my book, and it was just a way to get me on that table and my insurance to pay for it.
Well, look, I don't look at surgeons as money grubbers. It's not that. I don't think they have bad intention. I think it's a culture that hasn't really advanced.
Yeah.
Technologically it advances. They get better and better ways to do it.
I'm hearing your show, and I'm getting the opinion that stem cell, if that was done to me earlier and I went through the regimen or whatever I had to do, I'd probably be better off.
Well, look, you don't want to take tissue out. Right. You don't want to take tissue out of the body. It's needed. You don't want to destabilize, a tendon, ligament, joint, or muscles or any of that kind of stuff. And I see all kinds of people that get fusions. Any part of it, believe it or not, people get fusions in their toes, and then they're a wreck afterwards. Fusions in the back, I see fail all the time. You probably know this, Robert, with your friend that had the fusion. The area that's fused, the vertebrae that are fused, they can often do well, but then the area above and below break down because there's more pressure there. So no, I'm not a guy that jumps into surgery. I did it once, and that was enough for me. And from seeing thousands and thousands of patients come to me who have had failed surgeries, I'm just not in favor of it. Don't kill the messenger. That's my message. And because of that, I'm doing injections instead. And don't get me wrong, there's a lot of cases where surgery is mandatory, but most of it shouldn't be done. And our culture is starting to change.
All the material you inject into your patients is their own material. Is that correct?
Well, if we use platelets, that's from your blood, right?
Right.
The process is simple. We just draw your blood, we spin it in a centrifuge, and we isolate the platelets and inject those. We can also get platelets and your own stem cells from your bone marrow. So that's a different procedure. So if you want to call the office at 800-300-9300, we can talk more about all of that. And if you want to email me at email me at www.lastemcells.com, I'll give you a phone call and we'll talk more about it. Okay? We're going to the break. So anybody that wants to talk to me right now, I'd love to hear from you. Thank you, Robert, for calling. Our phone number here is 870-5752. Thank you so much, and we're going to the break and come right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.